Hello there, Philippine NARS listeners and followers. How are you all doing? We are very thankful that you are here and joining us today at Philippine NARS. And of course, as you know, Philippine NARS is brought to you as a public service project by the PNANV, or the Philippine Nurses Association of Nevada, in collaboration with PHLV Radio. This podcast is, by the way, also streamed on Philam TV and now on Sky TV cable in the Philippines. And it's also available on YouTube, on Amazon Fire TV On Demand, Spotify, and, of course, our website. So thank you again for joining us today. So, whether you are injured or had spent some time in the hospital or simply have had that nagging pain in some parts of your body, you are always told that you need to go to physical therapy, right? So, physical therapy is supposed to help and improve your movement and manage pain and enhance your overall physical function by adhering to the treatment plans that you are given. So today we have invited two gentlemen to talk to us about physical therapy. One is Dr. Evan Bishop, the owner of LVL Up Physical Therapy, and it's a company that does physical therapy here in the Valley. And also Mr. Jerome Santos, who is a physical therapy assistant. And they will be talking to us about their jobs and the company in itself. So welcome, gentlemen.
Thank you for having us.
Sure. So Dr. Evan Bishop is a PT, DPT, and he has been a physical therapist in the Las Vegas Valley for over 10 years?
Correct. Yeah, so I went to grad school here in Las Vegas. I started in 2010, graduated in 2013, so I've been out of school for 12 years now. So if you count my internships and all my experience, I've been a resident of Vegas or the Valley anyway, for 15 years. I have over 16 years of experience total because of the work I did prior to going to graduate school, and then some of my undergraduate studies as well.
Okay, very good. And Mr. Jerome Santos, you want to tell us something about yourself?
That's me, yes. I'm Jerome. I'm a physical therapist assistant. I have about a tenth of the experience as Dr. Bishop, but I'm still making my way. But I went to Pima and recently graduated there. And obviously my mom is still upset that I'm not a nurse.
Oh my gosh.
I still am helping people, so that's the point. So I'm still happy that I'm doing physical therapy.
Very good, very good. So, Mom Santos, don't be mad at him. Just kidding.
We love Jerome, but I'm very happy that he's a member of our team. So
Very good. Okay. All right. So, I'm going to ask you some questions. What is the definition actually of physical therapy?
So I couldn't give you like the script definition from the dictionary, but physical therapy is a healthcare specialty that focuses on mobility and restoration of function. So that includes movement, strength, the ability to bear weight, the ability to use whatever it is that was having the dysfunction. So if it's a lower extremity, it's getting that movement and strength back to be able to support weight, to be able to walk, run, whatever the activity is. If it's an upper extremity, it's the ability to move it to be able to hold your coffee in the morning, drive your car, put your clothes on, wash your hair. Depending on whatever the goals are, that's kind of what physical therapy is. And it involves the use of specialized movement exercises, activities, or interventions, including like manual interventions that are both resistant and non-resistant that help restore that functional ability back to a person.
So you're actually treating or strengthening the muscular component of the body if it gets hurt, or?
So yes.
Okay.
We do work a lot with muscles, but more so it's skeletal and muscle involvement.
Combined.
So right, muscles move the skeleton, and then we have the additional soft tissue, so ligaments, tendons, fat. All of those things are that factor into what we're trying to accomplish, because that may be the area of injury, it might be what's in pain, it also might be the problem that's impairing something from moving or causing the pain somewhere else. And so what we do is we look at the root cause of whatever is causing the limitation. We address the root cause, and then we work to address any secondary ailments, limitations, or disabilities that would be a result of that root cause.
Okay. So there's a word called physiotherapy. What is the difference, or is there a difference between physical therapy and physiotherapy?
There's not a lot of a difference. So physical therapy is the English terminology in America or in the United States. Physiotherapy is what it's called in the UK and kind of some of the European countries and the European influence. They're basically the same. Some resources would tell you that physiotherapists are more hands-on and more manual, but because physical therapy or physiotherapy is such a broad spectrum of treatment interventions, there's plenty of physical therapists that I'm aware of, including myself, who are very manual and hands-on. So really the only difference is how you say it.
How you say it. Okay. All right. You'd prefer physical therapy, right? I'm more familiar with that term.
In the United States, that's what is used as physical therapy. But either way, sometimes my patients who are Spanish-speaking or from another country, they'll say physio, and I am not offended. It doesn't bother me at all. I just roll with it because we're the same. They're used interchangeably. So.
Okay. Tomato or tomato, same thing.
As long as the fruit tastes the same, it's good.
Okay, great. So there are many diagnoses and conditions where physical therapy is of great help. Can you tell us some of the most common conditions that you treat that requires physical therapy?
Yeah, so some of the most common injuries and ailments that we work with are people who have neck pain or back pain. And so anything that's related to that, you might have a neck issue, but you might not have the pain in your neck. It might be farther down into your mid-back or into your hands and your arms and shoulders and things. And so wherever the resource of the problem is, we work with that plus whatever it's affecting. And then we also work with a lot of like extremity issues, so knees, hips, ankles, elbows that have the ailment or issue right at that joint. We work with so like shoulders, we would do like post-surgical recovery or pre-surgical strengthening and preparation, so that if a joint is not properly prepared to withstand the recovery of a surgery, we'll help that person get to that point so that they can then undergo the surgery for correction and then withstand the rehabilitation that follows. So those are the major things, but we also work with a lot of like neurological condition patients who have post-stroke limitations, which can include so many things, whether it's arm movement, leg movement, walking, standing, balance. We work with plenty of those. We work with, so like Parkinson's disease is a neurological condition, or cerebral palsy, even MS. So we see those kind of conditions, and then how they affect the body and how they limit function. So we're focusing on that limitation and that function, but the root cause of that might be a neurological condition. But we don't treat the neurological condition. We just work on the physical limitation part that's associated with that neurological condition.
Correct.
And then there's specialty fields where in our clinic we're able to work with people who have vestibular disorders, so vertigo or vertigo-related conditions, so dizziness, post-concussion syndrome, whiplash from a car accident, things like that can affect vision and balance or their inner ear, like equilibrium. We can work with that as well. So those are kind of the most common that our clinic sees.
That your clinic sees, right. Okay. Yeah, I know my husband had two, bilateral knee replacements, and he had to undergo physical therapy. Let's see, I had a torn knee meniscus there.
Okay.
So, yeah, I went to physical therapy for that too.
Right. And they helped you probably restore any of that limited range of motion, the strength, so you could then use it to do what you need to do at a decreased amount of pain, a more functional and manageable status. And whether or not you had surgery, I mean, it's the same, right? Whether you have surgery, you still have to restore that stuff. If you choose not to do surgery, we work with people who want to prevent surgery all the time. And it's similar. It's a different approach because we're not trying to recover from the surgical trauma. Now we're trying to prevent that surgery. But essentially, it's the same goal: get the function and restoration of movement, strength, ability back.
Yeah, what I can remember most is that really made me thinking, well, this is really cool because, when you undergo surgery like that, you don't realize that each movement, even though, on a daily that you do on a daily basis, it comes into play. Like, you can't do it now all of a sudden. So I had to learn how to go up the stairs. So, things like that.
Which would include not only activating the muscles and using that joint, but then stabilizing it, right? And then having the balance to go up and down the stairs. So all of that comes into play. We'd look at that. And then we also look at the things that somebody didn't know that they were going to take for granted, like being able to go up and down the stairs, or stand up from sitting down, getting into and out of a car, something we do every day, or standing up off of the toilet, something we all do every day. These are all necessary functional activities that we work with people all the time to get back if it's lost, or make easier if it's getting more difficult.
Okay, very good.
I'm reminded how important it is every time I teach someone like these transfers, because it is something that they take for granted. So when we try to teach it, they get very emotional because they're like, oh, finally I can do that thing that makes me feel normal, because they've been lacking it for so long. So it's like, it's a very cool part of our job that we get to teach it back to them.
I don't have to scoot with using my bottom to
Isn't
go
that
up
nice?
the stairs.
Yeah, isn't that a wonderful feeling?
Yes, oh my God, that was so funny. Yeah. As I remember having to wear like a boot afterwards and still do the, what do you call this, the rolling walker. And I'm like, oh my God.
Yeah.
So that's it. It was a total learning, concept, I guess.
You managed to overcome it, so that's good.
Yeah, which I did.
Yeah.
It's good.
Yeah, it's a process, and sometimes it takes longer than others, and not everybody fits into the same box, but that's where having a specialist like a physical therapist that can coach you and guide you through it is really important. I mean, a lot of what we do can be seen and done on its own, but when we as human beings want to take the path of least resistance, and sometimes that path of least resistance means not taking any accountability or doing anything. So having a specialty who can break it down for you into a series of steps that will make it easier for you to accomplish, and with decreased amount of energy required to accomplish it, and at a safer rate and ability to then be able to return to where you need to go, that's really where physical therapy can come in and play a major role.
And you just talked about the benefits of physical therapy, right? Getting a person back to their own original functionality. And anything else you want to add to that?
No, it also helps that you're seeing this person repeatedly over the course of time, so you build that rapport and you're able to work more effectively together. That's what I like about it, is that we work with you one-on-one, and so we get to see your progress and be there for you for every milestone you get.
And we get to see it.
Yeah,
right?
Yeah.
Sometimes every day when you do things, you forget to take note of the progress you're making, but because we'll see you on a Monday, and then maybe we don't see you again until Thursday, and if something you struggled with on Monday is now easier on Thursday, we're going to make note of that. We're going to let you know, hey, this is easier, because when you look at yourself in the mirror every day, you don't always notice the little changes, but when someone else notices, you recognize it and you go, oh, okay. So that's a benefit of physical therapy.
Right?
Yeah, true. Yeah, you're your own worst critic, so it's always easy to criticize yourself worse. That's why we come in and be like, here's the objective numbers. See, you're really improving from where you started from day one. So it helps them motivate too, because you're seeing numbers that you're like, oh, it is working. Yeah.
Oh my God. Okay.
Another benefit is that we're another set of eyes, and so if something you've tried isn't working, then we can help you break down why is it not working, what's the limitation, what's the holdup, why, and take a different approach, because we're specifically trained to be able to look at that situation from different angles, find what it could be that we thought something was the cause, and it turns out that's not really the cause, and that could be what's the holdup or what's preventing progress. So we're trained to be able to look at that and then work from there. But until we build that rapport, like Jerome was talking about, it's easy to miss things like that, especially if you don't have the trained eye or the specialty and a coach, but also if you're not looking for it. So
yeah, you're right about that. So you have an actual plan of treatment, for specific things, specific injuries, ailments, or whatever.
We do. We don't always follow like a strict protocol. So post-surgical, a lot of times there's a strict protocol that a provider, so a surgeon will provide. But not everybody fits into the same box, and so we will take that protocol and we will use it as it's applicable and as necessary to each person. But at some point, somebody's not going to no longer belong to whatever that protocol is. So if you're an advanced athlete and they're going to give me only a 4-week protocol, that 4-week protocol is not going to get you back to that advanced athletic level.
Right,
We're going to have to surpass that and still continue to evaluate and advance your plan of care to you. So that's where a skilled physical therapy plan comes in, because it becomes individualized at some point to you and whatever your ailment is and whatever your needs and goals are. Because my goals wouldn't be the same as your goals if you were the patient. My goals are going to be get you back to moving, get the strength back, get the balance back, get the function back. But your goal might be, I want to be able to walk up and down my stairs without pain, which all my goals will include. Yours is just a simpler goal, not broken down into steps. But when you can go up and down the stairs without pain, all of my goals are completed, and your one goal is also completed.
Yeah.
You know?
Big accomplishment, I'd say, right? Very good. So you've talked about the benefits of physical therapy. Are there any risks for physical therapy?
There are. Jerome, what are some risks of physical therapy?
Well,
This is a question from your boss now.
I know, yeah, I feel put on the spot. Yeah.
Friend, not boss.
Yeah,
friend.
but there's a lot of like stuff we got to look out for. For example, if you have like certain sequelae with like certain like diseases, so like Parkinson's, we have to look out for some of the symptoms and stuff like that. Or even like post-surgical stuff. DVT is like one of those big things that are silent killers, so we have to be on the lookout for that every time we treat them. So we could be that second pair of eyes that Dr. Bishop was saying, that I can check out, hey, this looks a little red than usual. Maybe we should get a second pair of eyes on this just to make sure the patient's good and we're progressing as we need to.
Yeah.
Some other risks would include, like, because we do move body parts and we do apply pressures and resistances, muscles can get sore. You know, when you haven't moved a muscle a certain way against a certain resistance for a while, the response would be for there to be soreness, and that's a physiological response based on, you know, buildup of lactic acid in the muscles and tissues stretching and straining, but they're building and replicating, so that's what we want. That's how strength has occurred when it's tested under stress, right? But that doesn't mean it's always comfortable. You know, some interventions may leave a mark, like a bruise or a red mark or something. It's nothing's permanent. It's always temporary. But that's one of the risks, is that you may end up with that. So fatigue. You know, you're tired at the end of a session, but that doesn't mean you didn't accomplish what you need to. There's just a recovery period of rest that would be required. So nothing serious, unless there's like an exacerbating circumstance or extenuating circumstance, is what I'm trying to say. You know, if there's a fall or anything, because we test those things, you know, we stress balance, so we want you to balance. And is there a falls risk sometimes? So we do take the proper steps to make sure everything is safe, you know, and controlled.
Yeah.
But there's a 1% chance that you can't control everything. So
course.
there are risks associated with it, but the biggest thing is that it's controlled, it's monitored, it's set up to prevent any kind of risks other than, you know, soreness, fatigue, a little bit of marking maybe here and there.
Yeah,
So.
that's good. That's good. So, do you ever delve into how the patient is doing nutritionally wise, or
We
not
do,
there? You
especially
do?
yeah, we do, because
Very
we work with
good.
a lot of. So we work in accordance with other physicians, and so we have to take into account, like Jerome was saying, the things that affect them in a different way. So, for example, diabetes.
Right.
If someone has diabetes, they will heal slower.
Yes.
It's a natural part of diabetes, and so we have to take that into account and say, okay, well, you have diabetes, you know, and if somebody's overweight, they're not going to heal as fast as somebody who's underweight and doesn't have diabetes, right? And so we want to take that into account and say, you're not going to hit probably the same marks on this plan of care and this timeline as someone who doesn't have these issues. But that doesn't mean that you're not going to get them. We just have to make sure that we understand that, right? And so we want to make sure that their blood sugar is controlled, that they're doing okay. If someone has high blood pressure, we want to monitor that.
Yeah.
You know, if somebody's at risk for a seizure or, you know, a stroke or anything, we monitor all of these other symptoms, and so we have to be on the ball. That's part of the risk, is that we monitor it, we look for it, and that's really where that healthcare specialty comes into play as well. We're trained with all these other things, not just what we do, but to monitor all of these other signs and symptoms that can be associated with other conditions and illnesses, so that we can then benefit the patient the best.
Seems like you set realistic expectations to knowing all those like diseases. Like,
Yes.
So like someone with fibromyalgia, you can't expect them to like be very energetic, but there's a limit of what we can do, right?
There's a limit what we can do and what they can do, and so we
What
want
they can do.
to come together and benefit them the most without pushing them too far, but also without doing enough.
do you have any patients that have like some mental issues, and that poses a challenge for you guys, right?
Absolutely, yeah. So I've had the privilege to work with some patients who have like autism disorder or are on the spectrum, and sometimes that communication can be a little bit difficult.
Right.
But you know, we love our patients and we want them to get better, and we want to help them however we can. So if we have to be a little bit more patient and, you know, explain things a little bit differently, or just wait for them on certain things, we're willing to do that, because we're not there for the mark, we're there for the patient.
Yeah, very good, very good. Well, it looks like you're dealing with the patients from a holistic standpoint, actually. You know, not only with the physical therapy.
Yes, there is a lot of a blend between like Western and Eastern medicine when it comes to physical therapy, because we want our patients to get better, but a lot of it is promoting the body to heal itself. But sometimes the body needs additional help, not just through movement, but, you know, there's a lot of like holistic creams and stimulants and things like that we can also use that will help with blood flow, that will help with decreasing muscle soreness, you know, anything like that. So there is a lot of blend with physical therapy, and that's one of the things I really like, is that I can see both sides of the coin when it comes to a healthcare approach. I can see the Eastern medicine side, and I can see the Western medicine side, and physical therapy provides a good blend. And it, as a person who loves to learn, it has allowed me to be able to learn more.
Oh, that's really wonderful, and I'm glad you brought that up. So that's good. So, what are the educational requirements to become a physical therapist? Let's start with you first, and then I'll go with Jerome.
So to become a doctor of physical therapy, you have to complete a bachelor degree. Most people will complete it in a field of science somewhere, because then it allows those prerequisite courses to be completed.
Okay.
But you do have to have a bachelor degree, and then you have to complete a doctorate program from an accredited school. Generally, they're 3 years. Some schools now are slightly less, like 30 months, but it depends on how many breaks you take and things like that. That includes a year worth of internships. So most of the time it's 2 years of didactic information and training, and then it's a full year of internship and, you know, physical application. And that will get you your degree, but then to be able to practice, you have to pass a national board exam.
Right.
So a licensure exam it's a national exam, but then it provides you with your state license to be able to practice physical therapy.
So if you pass the state exam, if you should practice in a different state, do you have to take that exam again, or is it reciprocal?
You used to have to take the state exam, like a jurisprudence exam, but you only have to pass the national exam once if you do everything correct, as long as you renew your license every year. But you do have to apply for a license in another state, and sometimes they have certain requirements if you were in a practice or change states, move, something like that. But they've made it a lot easier now with the internet, so that you can transfer things a lot quicker. You can be licensed in more than one state at the same time now, whereas before you were not able to do that. So advances in the career and in the path have made a lot of difference with people being able to do that. It provides a lot of opportunity. For example, if we decided we were going to expand into like Arizona or California, we could do that. We could hold licenses for all of those states and still have it all be under the same company. You know, we would just have to, based on how we would bill, divide that up by state. But in order to be a practicing physical therapist, you have to complete those minimum requirements of a bachelorate program, and then a doctorate program, pass the licensure board, and whatever licensing examination for each state.
Well, which, you know, makes a lot of sense. But when did they start requiring the doctorate degree?
All programs, as of 2012, became doctorate programs.
I see.
Prior to that, it was master's, and then prior to that, it was just a bachelor's degree. And physical therapy actually developed from nursing. So the initial physical therapists were nurses back in the war, and they were providing movement rehab. Really, like literally.
That's how physical therapy really they get started.
That's really how it came.
Oh,
so Nurse Mary McMillan she's kind of coined the mother of physical therapy, and she was a nurse. She realized that these soldiers who were having all these issues needed to move, and that movement helped them heal faster, because blood flow is important, and it carries all of our nutrients and our, you know, all the positive stuff to our tissues, and it's a huge part of healing. So she developed these physical programs, essentially, and she became the first physical therapist, and then she helped develop a program of physical therapy, and it all evolved from nurses.
Yeah. Was it called something else? We were called like rehabilitation aides or something.
Yes, they were rehabilitation aides under nursing.
Wow. Okay. Well, That's good to know. Okay. So, well, thank you for that. And what about you, Jerome? What are the educational requirements, or to become a physical therapy assistant?
Oh, so all you got to do is you got to go to an accredited school. I think it lasts about two and some years, but it includes like same didactic stuff. And you get clinical rotations, and then you have to pass a board exam because it is a licensure. So once you do that, you can be a physical therapist assistant. You can help people in physical therapy.
Do you have like a training involved, like specific for like to be under a physical therapist per se before you can get your real actual certification?
You mean like to go
like
under physical therapist and see? Yeah, usually that's with our rotations. So we can go with...
Oh, it's like your clinicals then?
Yeah, it just depends on who you... Sometimes you get an assistant, sometimes you get a doctorate of physical therapy. So it just depends where you go.
Oh, okay. So... Let's see. You like it?
I love it. Yeah, it's
It,
amazing.
right? See, Mom Santos, he loves it.
Not good enough for her.
Not good enough for her.
She's scolding me through that screen, I'm sure.
It's good enough for me.
Oh my goodness gracious! So you have a physical therapy office called Level Up. LVLUP.
Yes.
I didn't know how to pronounce it, but it was actually called.
It's okay, me neither. No, I'm just kidding.
Level Up.
It's Level Up, yeah.
Okay. Can you tell us what the services are of your office? What do you have there? Who do you treat?
Well, we offer a bunch of services, like we do musculoskeletal rehabilitation, post-surgery stuff, and then also managing of chronic conditions such as Parkinson's. But our stuff is on the website. I'm sure there's a lot. I just can't think off the top of my head, but those are the main ones that I can remember seeing.
So we help with managing neurological conditions and the ailments, orthopedic conditions and those ailments, and then like vertiginous and vestibular conditions and those ailments. And it all comes back to restoring function and mobility so that whoever our patient is, that they can live the life that they want and have the level of independence that they desire and have the quality of life that they deserve.
Very good. So you've been in business for a while, right? Since COVID?
We opened up right in the middle of COVID. So we opened our doors October 1st, 2020. It was myself, and then I have a partner that's owner Lorena Matthews. She is a physical therapist assistant as well. So she and I worked together before, and then COVID hit, and we decided that it was worth the gamble to see if we could do it ourselves. And what we ran into is that with all of the limitations of COVID, we weren't able to be the practitioners that we wanted to be, and we knew that we were capable of.
Right.
And so we found the opportunity, this location where we're at on the east side of town here. And somebody else had closed, and it was not an abandoned clinic, but they had closed because of the financial strain of COVID. And so we took over their space, we rebranded and made a lot of renovations, and we have turned it into our own. Our name is Level Up Physical Therapy because we actually feel like with what we're able to provide, people can't just return to where they were at. They can actually get to a higher status. And so that's where that level up comes up. Nice. We don't want you just to return to where you're at. We want you to return to where you want to be. And most of the time, people don't just want to be at the very bottom status quo. They want to be a little bit higher than that. And we want that for them as well. So that's why we want people to not just feel better. We want them to level up.
Oh, that's awesome. That's great. That's good. So what insurances can you take?
So we take most of the insurances in the Valley. There are certain insurances that have contracts with other companies that we're not credentialed with, and so if we don't accept someone's insurance, then we have payment plans and cash options and stuff that are available. But we're willing to work with anyone that's willing to work with us, whether or not it's insurance-based.
Insurance-based or not. Correct. Okay. So,
and that information is available on our website as well.
Okay, and your website is?
It is LVLUPPTLV.com. So levelupptlv.com.
I believe we can show something on the screen, which picture. And where are you located?
We are located on the east side of Las Vegas. We're on Pecos between Flamingo and Desert Inn.
Flamingo and Desert Inn. Okay. So if someone would want to come over or, want to secure your services, what they have to do, they just call or go to the website and...
They can call, they can go to the website and use our chat bot and submit an appointment request. They can walk in and we can talk to them. They can take a tour, and we're more than happy to do a free tour and maybe a consultation and see if there's what they need is what we can provide.
That's good.
So all the options are available, really.
And we're bilingual too. We speak English and Spanish.
English and Spanish. Tagalog?
Okay, yeah, we speak Tagalog too.
And you said something about Chinese or Cantonese or something?
One of the co-owners, I think, speaks Cantonese, yeah.
Okay. So you can, that's good.
So we're multilingual.
You're multilingual, not only bilingual, right? Okay. Let's see. What else do you want to say about your company and about your experiences?
Well, lots of things. I mean, I could talk about my company forever, right? Like,
well, yeah.
It's part of my identity. I think the biggest thing is the biggest thing is that we like I said, Lorena and I opened our company because we could see that there was a flaw in the system, and we wanted our patients to get the attention that they need, and not necessarily have it be determined by what the insurance company says, or even maybe another medical provider that isn't for sure in the know, wants the best for their patient, but just isn't in the know.
Right,
I don't think there's doctors out there that don't care. I think there's doctors who maybe just aren't always informed. And so we wanted to be the company that focuses more on quality versus quantity. And we actually care whether our patients get better or not. I'm one of those providers that if something's not going well and it's not working the way we want it to, I take a step back and I analyze it because I care whether or not my patients are able to progress. And I take it personal if they're not. And that's kind of our approach, is we take a personal approach to whether or not all of our patients are achieving their goals. And if they're not, we're going to help you work through it, figure out why, and help you get through it. Which is why our motto is to provide superior physical therapy care. Or this is our mission statement, sorry. Our mission statement is to provide superior physical therapy care to all of our patients so that they can hit their maximum potential, whatever that is.
Very good.
Not just the baseline, the maximum potential.
Yeah.
So in a sense, we want our patients to level up.
Level up, yeah, that's good. What about you, Jerome? What can you say about the job and where you want
You hit it right on the head. Yeah, basically we do care about the patients. Like every clinician there is very invested in each patient's care. Like we want to make sure that they're getting the utmost important care that we can provide. Like we try to make sure, like he said, it's quality over quantity. Like we don't see more than we can handle. Like we make sure we maximize the amount of time we spend with each patient.
That's very good.
That's why we level up. Because I've seen other places that work. I kind of like their setting the most. This is exactly what it's in line with my values. I want to provide what I can. Yeah. But there's only one of me, so I have to make sure I can give my most to each patient that I see.
To each patient that you see. That's very good. Mm-hmm. That's very good. So, everybody, if you want to do a self-referral, if you want to just walk in and see what Dr. Bishop and Jerome here can do for you, they are located at 3777 Pecos McLeod Interconnect, right?
Correct.
And that's at Suite 102, Las Vegas 89121. Or you can call them at 702-205.
725.
Oh, 725.
We're a
my
725
bad.
number, yep.
725-205-8500. So, there you go. Okay. So, what is your message to the community about physical therapy? And is it worth considering and all that?
I personally think it's definitely worth considering, but that's because I've invested 13 years so far into this. But physical therapy in itself is a proactive healthcare field that promotes the most, or I would say maximum function that somebody has, whatever level that is. We do have limitations. We can't regrow limbs and we can't fix paralysis, but we can help you achieve whatever the maximum potential you have in spite of those things. So physical therapists are passionate, caring coaches and guides to your physical function and being the best that you can at the most independent level that you can and that you deserve. That's how I feel about it, and that's why I do it.
Good, good, good. What about you, Jerome? What's your message to the community?
Well, I think you, as a person, owe it to yourself to level up your body. So you definitely need to come on to Level Up Physical Therapy and elevate your lifestyle. So definitely come on by.
Okay, so you're gonna have these two fantastic gentlemen to take care of your physical therapy needs. So thank you so much, Dr. Evan.
It's a pleasure.
And,
Thank you,
Jerome
Thank
Santos, for coming to our podcast today to basically explain what physical therapy is. We appreciate you taking your time from your busy schedule. I know that you are very busy. We've sort of kind of had this planned, and then, we had to back down a little bit, so you're too busy. But I do appreciate you guys coming. We do appreciate you coming. So if you have physical therapy needs, like we said before, please call Level Up at 725-205-8500. And so we've told you where they are already located. And to our audience, again, thank you very much for coming again. And so to our audience, we leave you with this. Physical therapy is a treatment method that helps individuals recover from injuries, to manage their chronic conditions and improve their mobility. It involves a combination of exercises, stretches, and movements tailored to the patient's specific needs. Physical therapists and their assistants are trained professionals who assess and treat physical ailments and help you regain the strength, function, and flexibility that you had before, or maybe even a little lower, but still will level up, like they said. So please consult your healthcare provider if you have a need for physical therapy. And so that's what it is. And thank you very much for joining us today. Be safe and be well. Until next time, this is Doris Bauer, your Philippine Nurse host, signing off for now.
Just like a friend from back home.
This is your Filipino radio experience in Las Vegas. PHLV Radio.